Well, we continue talking about the pandemic, and this time in the African continent. Kenya is a country that is grappling with the coronavirus, and this is the Delta variant, highly transmissible, which recently resulted in the western part of the country being put into lockdown, which now threatens the capital, Nairobi. Joining us right now, Dr. Diana Achando, Medical Officer, Aga Khan Health Services, joins us from Nyanza, Western Kenya. Thank you for joining us on the program.
You're very welcome.
All right, Dr. Achando, the Kenyan government seems to have reacted quickly, and this is to the previous 3 waves. But what's happening now? What's the situation?
We just recently got out of a lockdown in the Nyanza Western area. We are seeing a sudden rise in the number of cases that we are noting in Nairobi, which is the capital city. So we're having a shift of the epicenter moving from Nyanza Western region towards Nairobi. So the restrictions that were actually enacted a few months ago have been lifted for this region. And we are considering moving them actually to the capital city, essentially.
What would you say happened that it appears Kenya was bracing for the 4th wave?
I think there's been a bit of social events. We're seeing more and more people attending funerals and weddings. We have a lot of travel in and out of the country and within the regions, which is allowing this spread. So we are seeing an increase in the infection percentage. So we have at least 15% of people who are testing positive for this. The Delta variant is, of course, highly infectious, way more than the previous variants that we had. So I think it's introduction of the Delta variant and just relaxation of the general populace in terms of the rules that we've put in place.
In your opinion, do you think coming out of lockdown is, the best decision right now in terms of this Delta variant and, the many cases the country is recording?
I definitely think we should be considering a lockdown within the capital city, which has shifted to being the new epicenter. I don't think coming out of the lockdown is the wisest idea. However, there is a lot of speculation when you're in social circles that it might be for political reasons, where people want to start campaigning because we have elections next year. And in fact, the shift of the epicenter coming towards Western Nyanza was because we had some sort of political celebration. And so we are seeing the effect of this. We have been grappling with these effects for a month or 2 after, and it looks like that's what's going to happen in Nairobi. So it's definitely not the wisest thing. However, the motivations may be more than people's health.
But indeed, with all of this, the economy and social life in general is also negatively affected. But how is this affecting you as a healthcare worker?
Definitely fatigue. You have to be extra careful for the last 1 year. So I note a lot of fatigue amongst my colleagues and myself as well. You get a little bit tired of being, ostracated around people who you used to know. You get a little bit tired of having to wear a mask and sometimes 2 masks most of the time, or wear PPEs. So this is definitely affecting healthcare workers in that way. You're also highly likely to get this disease, because unlike the rest of the population, we have more and more people that we are seeing coming in with respiratory symptoms. This is most likely COVID. So we're at a higher risk. It's definitely affecting the mental health of healthcare practitioners. So we're seeing a lot of organizations trying to emphasize on mental health, especially for healthcare practitioners.
And still on healthcare practitioners, in terms of welfare, how much is the government providing? One is the PPEs, the tools that you need to fight this pandemic, protect yourselves, and of course, man the healthcare systems. How much is government supporting health workers in Kenya?
We have a lot of support from non-governmental organizations, that we must admit. We've had times where certain counties, because the country is run in counties, it's a decentralized system. We had certain counties saying they can't see patients anymore because they don't have PPEs. So the PPE supply has been better than it was, for instance, 6 months ago. However, it's still not excellent. We still have some staff who are not able to access all the PPEs they need. However, there's been vast improvement from when we began the pandemic, and we're slowly seeing the Kenyan government stepping in a bit more to make sure that the healthcare workers are protected.
I want to come back to the virus again, and this is with some people commenting that a country like Kenya is experiencing low deaths from the virus. I mean, any death is still a death, but do you think that there is a reason or more why this is the case? Are people doing anything differently in Kenya?
I think for Kenya, the explanation we would have is the COVID is highly infectious in slightly older people. Most of Kenya's population is actually under 35. So you have more and more people who are not as susceptible to this disease as you would have, for instance, in European countries. So the population and the distribution of the population is definitely a big deal. And then, of course, we have also a good amount of the Kenyan population is not urban, meaning you don't have a lot of people interacting as much as you would, for instance, in major cities, if you're thinking about New York or Paris. It's a lot of, we have some rural areas, so you don't have a lot of those people mixing up as much as you would in urban areas. And then, of course, I think maybe it's just not excellent statistics. We have people dying and we don't have a cause of death. We don't have enough medics to actually do these postmortems to find out what killed these people. We still aren't excellent when it comes to testing because a lot of people, to be able to access testing, it might be expensive for most people. And so maybe we're not testing enough. Maybe we don't know these people had COVID before they died and we're not doing enough postmortems. So those are the factors I would attribute it to. And of course, the weather.
Okay, and finally, Dr. Chando, we are not excellent with vaccination, are we?
No, we are not at all, even amongst healthcare workers. I have several colleagues who are hesitant on getting the vaccination. We have a lot of conspiracy theories in the public. We have a lot of people worried that this might influence their reproduction. We have people worried that getting the vaccination might lead to a blood clot. So we don't have a lot of people who are believing that this is actually a good thing. And so we are currently at just about 2% of the population who have gotten a vaccine, and we have about 1.3% fully vaccinated. So people are a little scared of the second dose because we are using the AstraZeneca dose. We are also using the Pfizer one. And you have some people who are a little bit afraid of getting a second dose because they're reeling from the side effects of the first one.
We appreciate your time. Thank you so much. Continue to stay safe. Dr. Diana Chando is a medical officer with Aga Khan Health Services. Thank you so much for joining us on the program.
You're welcome.